We're ready for incision.
Wait a minute.
What is this?
It's a monitor, glucose monitor. I got diabetes.
What's diabetes?
Please talk to your surgeon before you undergo the knife. Hello, Nation. Today we're going to talk about surgery, and if you have diabetes, what to look out for. Today I have my good friend and colleague, Todd Walker, who is a surgery resident at UCSD. He's going into orthopedics. In fact, this year he's doing a year of research on stem cells. Unfortunately, it's for joints, not so much the pancreas. Todd, thanks for joining.
Thank you. Glad to be here.
Let's start off by kind of an overall question. What are some of the unique features that relate to surgery and people with diabetes?
Yeah, good question. Some of the important things are, I would start off, number one is communication. Your diabetic, your endocrinologist, your family practitioner, your surgeon, everybody should be in the same loop of what's going on. There's important aspects before the surgery that need to be discussed, like your medications, your devices, what you're going to do after surgery in regards to restarting your medications, and then kind of just protocols each specific surgeon might have dedicated just to diabetes.
I think that's sort of the one of the most important points. Are there any particular differences between type 1 and type 2? And I'll throw in there the type of surgery you have.
So some of the different differences for type 1 and type 2 that we really worry about is the medications is first and foremost the most important. There are also some differences during the surgery, especially with the devices, if you're wearing a sugar monitor or an insulin pump, that we would really like to know about. Exactly. And then the anesthesiologist would really like to know about that. They can hold on to the devices before the surgery, monitor your sugar as well. These are very important things, especially if you're going to be using x-rays, different imaging devices during the surgery.
You know, I've had many an anesthesiology story from patients tell me that they tell them to stop their long-acting insulin or take off their insulin pump the night before surgery. And I think that's where the distinction between type 1 and type 2 diabetes come in. And that usually ends up as disaster.
It can end up a big disaster. Some of the things, if you don't discuss it with your surgeon beforehand, a lot of people get confused on what they should do the night before, what they should do afterwards, and this can lead to hyperglycemia, hypoglycemia. Everybody's bodies react different to surgery. Like again, we said, the communication between everybody is the most important.
Now, I know just a little more specifically, what should people with diabetes be thinking about the day before surgery and the day of surgery, like the time of surgery, things like that?
So your sugar levels the day before surgery are very important to note. There's some surgeons that won't operate on elective cases if the sugar levels are too high. And then everybody's bodies can react different after the surgery, so you could become very hyperglycemic just from stress of the surgery. So monitoring your sugar at a more frequent time is very important.
Yeah, if you don't have a continuous glucose monitor, if you're a type 2, then you really need to just do a lot of testing, and that's going to help you out tremendously. What about post-operatively? Do people with diabetes get more infections at home? Is there anything extra other than testing your blood sugar and making sure you're in a good zone?
There's some good evidence out there that says if your sugars are uncontrolled or if you have a high A1C prior to surgery, that you are at an increased risk for having wound infections and hardware failure. So it's, a lot of times we'll tell these patients the strict glucose control afterwards is very important, as well as trying to maintain a good A1C for the next month to let your wounds heal and so the hardware doesn't fail.
Yeah, you know, a lot of surgeons, they're short-sighted, sorry. They look at the blood sugar that morning. If it's high, they cancel. I think they should look at the A1C. If it's like 10, 12%, you and even if you go into surgery that day with a normal blood sugar, you're still chronically under poor control. What about pain meds or any other medications that can affect the blood sugars?
Very important. So there's a few medications. Steroids are very important. They can cause a spike in blood sugar. There's some antibiotics that will also cause a spike in blood sugar. And nowadays, especially patients with diabetes, we're always giving patients antibiotics before and after surgery. So discussing with your surgeon what kind of antibiotics, what are they going to do to my blood sugars, what should I expect is very important to have.
Lastly, and I think very importantly, a lot of things can happen when you're, under anesthesia. How do you pick a surgeon that you feel confident with? Like, listen, I know you have diabetes, you understand it. I trust you to do my implant any day.
Most important, surgeons should feel
That was a joke, by the way. Come on, man. See how straight these guys are?
A surgeon should almost think that your medical conditions like diabetes or your blood sugar is more important than actually having the surgery in beforehand. They should be wanting to communicate with your endocrinologist or your primary care doctor. And even surgeons that even have diabetes or have family members that have diabetes is important as well.
Yeah, that's your screening question. Any family members with diabetes? Well, so much important information. I mean, just communication and making sure everyone's on the same boat. And sometimes that's hard in our current medical system. I want to conclude with one comment about why I carry a mask with me in my briefcase when I fly. Because when I take the Southwest flight, I get in the seat closest to the window, I put this on, and if there's one seat extra on that plane, it's right next to me. And people look at you like you got some type of disease. As soon as we take off, I spread out my laptop, I'm all set. So long, nation.